Abdul Ghaffar. This is the Global Digest Think Tank Group. You are our guest today. Exactly what are you doing and where you are based? Please, Abdul Ghaffar.
Okay, thank you so much. I'm glad to speak with you today. I am in Nigeria. I am the founder and CEO of Sunshine Gender Humanitarian Women Rights Initiative. And Humanitarian is one of our core programs. Although we have other programs that we do, but Humanitarian is one of our core programs. And personally, by my nature and by my upbringing, I believe so much in humanity. And I believe that when we all stand to help each other, there will be peace and the global world will be okay. And on this, what we do in terms of humanitarian, we assist the children. In terms of educational development, we empower women, we empower youth, and also we do attend to an emergency humanitarian like accident and others, or emergency medical issue.
I see. I mean, car accident. Nigeria government, you don't have a kind of emergency call center.
We have in Nigeria, but the government cannot do it alone. And a humanitarian AG organization normally get involved, most especially in the aspect of assisting the victim, paying the bill, the hospital bill. So we have the department that attend to emergency whenever there is accident. We call them Federal Road Safety Services in Nigeria. But there are times that after the victim being taken to the hospital, the bill might be too much for the victim or the victim family to pay. So this is where our role comes in to help them to settle the bill.
I see. I mean, yes. Do you have a kind of insurance like car insurance or driver insurance? Is there insurance system in Nigeria?
We have car insurance. We have car insurance. However, the level of education in that aspect is very low. Not everyone do involve in car insurance. Secondly, sometimes the payment time for the insurance is too high for some low-level poor people to get themselves in.
Right.
Yes. So we have the economic aspect here is not balanced compared to the Europe. The difference between the poor and the rich here is very high. So someone who have not been able to eat in the morning, in the afternoon, cannot even think of insure his car.
Right.
Yes. And there are times that maybe the victim of the accident does not even have a car. It might be on a public transit. And the owner of the public transit does not also insure his vehicle. So it's left, any victim inside that vehicle is being left to their situation. So that's the situation we have here.
This is probably insurance system is not much useful in Nigeria because of the level of poverty, and most majority of the population are not benefit from insurance system, and it's not you can say it's not the right system, or it's not appropriate system, in Nigeria.
What I'm saying is that it is only working for the rich.
That's why, I mean, rich are minority, a few people, elites, but majority are not rich, so it's not useful for majority.
Yes. Okay, thank you. Here in Nigeria, the insurance company is being operated by private individual. We have a company who are focused in insurance, such like the way we have banking sector. So they are being operated by private individual. So, but under the regulation of the government. So in Nigeria, we have two regulations. We have a body called the Central Bank of Nigeria, The Central Bank of Nigeria do regulate the conventional banking system. Then we have what we call NDIC, Nigeria Deposit Insurance Corporation. So they do give a regulation on the insurance sector. So if you are a rich man, you are in Nigeria, you feel like you have the capacity, the influence, the financial aspect to open and operate and meet up with the requirements set by the government to operate insurance company in Nigeria, you will do.
Surviving, people cannot think about insurance. So that is most people's situation in Nigeria.
Yes, we have Lasaco Insurance. We have here insurance owned by the one of the richest in Nigeria in Africa, Tony Lumelu, and we have and others feedback. So these two are the major that the rich people really patronize. But we have other smallest ones that they are just fighting to survive within the insurance industry. I really agreed with the President Donald Trump on that. Factually, when you look at a different country, the insurance has never worked well for the poor. Yes, it's always be the last thing in their agenda when they are looking for food, shelter, and survival. So they don't even think of it. But in time of relationship with insurance company and the government here, as I said earlier, the government set the tone in time of the policy and regulation. Why for the insurance company to be able to operate. So the relationship between insurance company and the government is all about the regulation and authority compliances. Yes.
I see. So I mean, it's good relationship between insurance company and Nigerian government. Yeah, and probably, I mean, I don't know, they may be turn blind eye about poor people who are looking for a meal.
Yes, we work on the apart from car accident, we have a situation whereby it's not issue that has to do with accident, it has to do with medical issue. Someone just fall ill and then they cannot be able to pay the bill. So we reach out to the hospital or the person wrote to our organization, then we assist based on what we can do. So, but these are just the emergency aspects of our humanitarian. We have the one that is not emergency. So like the one that is not emergency, like every year on 11th of this March, we did our annual food supply to 200 vulnerable group in Nigeria. So during the fasting period for Christian and Muslim, we combine, we don't distinguish either Muslim or Christian. As far as you are vulnerable, we give you food that you can eat for the period of 1 month. And the package contains different type of food that we eat in Nigeria. So this is part of our humanitarian. This is not an emergency. So in our humanitarian work, we have emergency and we have non-emergency that we do. Yes. This current one, the last one we did it in North Central of Nigeria. So we have in Nigeria, we have 6 regions, the North Central, Northwest, and Northeast. So, and under it, we have almost 6 different states there. So we did this one in North Central and we just picked 200 people. That is the capacity that we have in our organization for now. So we are open to be able to expand it more and make it to cover across Nigeria yearly.
I see.
200 last year.
I see. You distributed 200 people who are vulnerable for food.
Yes.
In Nigeria.
It's a package. If you go to our website, you will see everything. It's a package. Normally contain rice, beans. That is what we call gari. So I don't know if you have heard that. It's made up from cassava. So poor people normally, you can use the gari for 2 things. It's either you put it on water and you take it directly, just like you are drinking tea. or you use it to make what we call is a group of carbohydrate food that you can use to make what we call eba. Just like I don't know much about your food there, but every food. So we put gari, we put spaghetti, we put tomato paste for them to be able to make a soup. Then we put sugar. Yeah. So that is then also millet.
It is
Yeah.
African food or is European food? How can you say that?
And this is Africa food. In terms of the SDG, when you look at the SDG 2 of United Nations, you will see that there are a group of people that has been classified as poor. So this has been itemized. Anyone who cannot be able to feed or survive, they need an humanitarian services. And what we believe is that the government cannot do it alone. I don't know for Europe, but here in Africa, no any government can be able to do it alone. However, they should be able to do it alone in another side, but this is not where we go to. But due to corruption, they cannot be able to do it alone. This is why non-government organization with well structure, transparency, accountability, and integrity need to step in, not for the sake of anything, but for the sake of humanity. So we identify, this is how we normally do it every year. We identify the people, we make announcements if you are in this summit, and then we screen them. By you seeing someone, the kind of house a woman being live, whereby when rain is falling, water will enter. Such person needs the help of a food. So we have other group that maybe a wife, which the husband has died and she become a widow. She cannot be able to, she has plenty children, she can't do much, she need that food. So these are the in line of SDG 2 that we normally use to select this group of people.
I see. So that is not emergency humanitarian assistance. You provide us.
Yeah, that is not.
You provide also emergency assistance, mainly only car accidents or other accident too?
No. We do also other who are not emergency, like just medical and others. Like we also have maybe house emergency issue, maybe when there is flood. And we have Red Cross in Nigeria. They normally do big in time of that, when there is emergency in time of flood. So we don't involve ourselves when we have flood issue, but when the victim reach out to our organization, because we don't have a maximum resources now. So we don't take ourselves to say, yes, there is flood in this state. How can we help you? No. When the victim reach out, we look at the resources we have, because resources, we don't have a capacity to face it and take care of 200, 500 people. But when we have 1, 2, 3, 5 victims that silently discover our organization and wrote to others, see, I experienced this and I need your help, no matter how little, then we do.
I see. So you are not directly dealing with the flood disaster, but you are dealing with the medical assistant who are left out by the government assistant or Red Cross assistant or anybody left those victims at the hospital or clinic if they still need medical or health assistance. That time you helping them
financially. It's between 100 to 150. It's not up to 200.
I see. So yes, you provide financially to the medical assistant.
What we normally do is that we don't go by day, we don't go by month, we don't go by year. We approach, when the person approaches or we approach the hospital, we look for those that have a lower bill. There are some victims that all what they just want to pay is 10,000 naira. There are some that could be 5,000 naira. There are some that will be 15,000. There are some that will be 20. Up to 25, we look at it and we take their statistic and we pay. So some 10,000 naira is enough for the hospital to take care of them and make them well and discharge them. So we don't normally do maybe how many months. No, we just look, excuse me, we are paying for this also. How much is the bill? The bill is 15,000. We pay it, then it's settled.
I see. So it means you are not fully responsible or fully take care about the patient, but you just helping those who are a little bit remain financial difficulty, the remaining, as you said, 5,000, 10,000, you are assisting the remaining one, but not the whole responsibility.
Absolutely. And also there is something I would like to add in terms of our humanitarian. You know, there is what we call an empowerment. But when we go into deep aspect of humanitarian, we normally find out that both humanitarian and empowerment, they become inseparable when we get to the top. So I would like to also mention our empowerment aspects for the children, because we focus more on the vulnerable children. So at the top, we can classify it as part of the humanitarian. Do you understand? And what we do for the children is to ensure that their education is continuing. We do pay school fees. Last year, we were able to pay school fees for about 59 school children, and we are able to give a school 20 sets of chair and locker last year. That was in June last year. These 20 sets of chair and locker can accommodate 40 to 60 children. So if they sit 2-2, it will take 40 children. If they sit 3-3, it will take 60 children. And this year, February this year, we are also able to donate another 20 sets of quality chair and locker to another school. This is in terms of education. And we also normally meet with the children, encourage them, and make sure they are aligned with their education, forget about their poverty mentality, thinking their family are poor. They should believe that tomorrow will be good. So for the women, we normally empower women. We are able to reach out to about 355 women last year, because our project is on a monthly basis. So we do two-way. We give financial assistance for those women who already are in business. They just need financial assistance to uplift their businesses. And those who have an idea and they want to start, so we do that. We are able to do in June last year, and we are able to do in July, and we are also able to do in August. Like what we did in August last year was even different. What we did was complete vocational training and program, because when we receive our report, we find that most of those who receive the financial assistance, after like 6 months, 1 year, they could not handle their business more, and their business capital normally eroded. So we said, no, we are going to do something different. Let's bring a set of 23 women and see. We are going to teach them on liquid soap. That's what we call a liquid soap, just a normal soap that is used to wash or take bath, but liquid one. So we taught them how to make a liquid soap. Everything is on our website. And also another group, we taught them how to make a pop-off. And then we give them all the resources and material. They will start the following day. And all of them start the following day. Most of them are doing well. They are sending their children to school. We can say this one too. We can classify it as part of our program. We also have youth empowerment, but we have not been able to do for youth empowerment since we launched our organization. The reason is that the partnership we have, they have their plan and their intention. The partnership we have now focus more on children and women. We have not been able to secure a partner that they are ready, that we should spend their money on youth. And you know, as a reputable organization, if a partner says, see, in your organization, SDHHR, I'm signing a partnership and I want you to spend our donation on children and women, I normally ensure that we maintain integrity. We don't want to divert the money to the youth. So I have been working to see how I can secure a partnership for organization that will support us in time of youth, then we do.
I see. So you said empowerment and youth education, something like the training, and also you produce some stuff and you sell it for fundraising, something like that.
Okay. Our organization is open to different funding sources. It started, the first is the founder and CEO, that is myself. When I launched the organization, I funded it myself personally for almost 7 months. Myself. And I'm still doing that myself up to now. But currently, our source of funding is focused on partnership. From one is in Nigeria and one is in UAE. So the UAE partnership focus on children and women empowerment. While the one in Nigeria is also abroad because the person is also a businessman from India, but has his business in UAE. So what he do is that, see, he also has a business in Nigeria. So he's making the donation from his company in Nigeria. He also has interest in just children.
Thank you, Abdul Ghaffar.